My name is Cara Guy and I'm from the Media Hut, and we are very fortunate to work with Australian Rotary Health, one of Australia's largest independent funders of mental health research. We are thrilled to have such an illustrious group of leaders in their fields to join us today, and we're here to launch our ARH Lift the Lid on Mental Illness initiatives and shine a light on Mental Health Awareness Month with what is a very timely discussion, I think. Speaking with us today and talking about experts in discussions, today we've got some of Australia's best joining us. So to introduce everybody as we go, Professor Ron Rapee, who is a Distinguished Professor of Psychology, an Australian Research Council Laureate Fellow, the founding director of the Centre for Emotional Health, and Ron's background is in clinical psychology, especially the understanding and development of mental disorders, and he has a history of developing treatments and programs evaluating their efficacy through clinical trials. Foremost one of these, and certainly something that the ARH has been very proudly involved with, has been the development of the Cool Kids suite of programs, which is now translated into over 25 languages in over 30 countries, I think, Ron. That's correct?
Yeah, look, I lose track of exactly how many countries, etc., but it is used around the world, and yeah, we have a number of different translations. And you're right, Australian Rotary Health has been supporting us across a number of our scientific trials, and thanks to the support from Australian Rotary Health, we have been able to develop the program and develop new versions of the program. And part of that international acclaim is because of the scientific work we've done, thanks to Australian Rotary Health. So it all works together really nicely.
Fantastic, thank you. So joining Ron, we've got Dr. Claire Kelly, who is the Director of Research and Curriculum at the Mental Health First Aid Australia, where she's been involved now since 2003. When she first became an instructor while completing her doctorate at the Centre of Medical Research at the Australian National University of Canberra. Claire's main passion is the mental health of young people and minimising the impacts that mental health problems can have on development, educational outcomes and long-term functioning. And I think at the moment that couldn't be more relevant to the discussion that we will have today. In addition to Claire, we have Dr. Kylie King, who is a Senior Research Fellow at the Turner Institute for Brain and Mental Health at Monash University. She has expertise in male suicide prevention research and is particularly interested in the capacity for public health interventions to have positive impact on boys and men's mental health and suicidality across the lifespan. She is leading an evaluation of school-based suicide prevention intervention aimed at teenage boys, and Kylie has also worked as a psychologist across public and private settings as well. So all three of these fabulous researchers and activists in the category have created programs that have been funded by Australian Rotary Health, which is at the heart of why we're here today, obviously. Maggie Dent, who many would be well familiar with, has become one of Australia's favourite parenting authors and educators, with particular interest in the early years and adolescence and resilience. Maggie's experience includes teaching, counselling, and working in palliative care and funeral services and suicide prevention. She's a dedicated advocate to quietly changing lives in our families and communities, and she is also a mother of 4 sons and a very grateful grandmother. Maggie is the co-host of the ABC podcast Parental as Anything and author of 7 major books, including a new one that has just come out titled From Boys to Men, which explores raising teenage boys. And I think Maggie will get very topical with some of that information as we come through. So from the media, we have Ben Pike, who is an urban affairs reporter, passionate about Sydney, how it's built, how it's governed, and the people who make it tick, specialising in local and state government issues, development, construction planning, and really getting quite poignant with mental health recently. And some of Ben's most recent work has been with some of the clusters on the northern beaches of Sydney, which there's a very devoted group of parents that are starting to create a lot of action up there, which has been fantastic. So we'll look forward to hearing a bit more about that. From ARH, representing Australian Rotary Health today, we've got Jessica Cooper, who is Promotions and Mental Health Manager. We welcome Margaret Milton, who is the Head of Marketing at the QBD, the bookshops, and they are partners with Australian Rotary Health in some integral new Lift the Lid campaigns that we have in marketplace that we've launched this year. Lift the Lid in Schools, which has been a little COVID affected. So we've been changing that as we go, but we're thrilled to announce that they are actually going to support that now for another 12 months into 2021, given that we need to extend the time. And in October, they are actually supporting with a wonderful initiative in store where $2 from a nominated set of books is being donated directly to fundraising support to Lift the Lid and to Australian Rotary Health. So Marg, welcome and thank you for your support. To Simon, who is on his way, and to Carolyn from Allen and Unwin, who are also supporting under the guise of Lift the Lid in Schools. Thank you so much for being here. To Charmaine Yabsley, who is our freelance journalist and esteemed health author, who works quite closely with us at Australian Rotary Health on content that we put into market. To welcome to Brendan Allen, from Managing Director from Stay at Home Mum, who I know has an enormous community of audience that are very interested in the topic. Tiff, we can't see, who's the Deputy Editor of the Women's Weekly. Amber Bramble, who has also joined us. Amber, hi, who is the lifestyle writer from all of the weeklies now, and all of the weeklies do live at Bauer Media now, or our media as they are this week. Nicole Pinder has also joined us from Mental Health First Aid, and Sue from the Media Hunt has joined us as well. So talking about experts, just to last but not least, I guess, to finish with a significant expert in her field and often referred to as the lifeline parents desperately need and a trusted source of information and inspiration when it comes to our tweens and teens. Will be in the very calm and capable hands of Rebecca Sparrow today. So Beck, thank you. Over to you. And yeah, we're in your hands. Let's get cracking.
Thanks, Cara. First of all, thank you everybody for being a part of this today. I think this is going to be an incredible discussion that is much needed. I guess if there has been one issue that has in parallel with COVID-19 dominated not just news headlines, but conversations in schools, in families, classrooms, community groups, it has been mental health. It has always obviously been important, but this year there is just a massive red flag waving over it. And I think for many Australians, the number one concern they have is, their kids, their teenagers, their elderly parents, their work colleagues, and friends, and of course themselves. And I'll just speak for myself. The more then I read headlines about the skyrocketing rates of anxiety and depression, the more anxious I start to feel myself. As for me, I have been, for those of you who don't know, I have been working in schools with kids and teenagers since about 2003. And my big passion is helping kids to have a great experience when they're at school. That's my big thing. And it's usually not so much from an academic point of view. I'm really interested in them having a great experience from a social and emotional point of view. And I can say that going into schools this year, I have been inundated with requests and conversations because we are seeing massive tension in the classroom, in friendship groups. I was in a primary school last week with year 5 and 6 girls who were self-harming or with disordered eating. We're seeing these, so much talk about anxiety and depression. So I guess that's one of the reasons why we're here, to have an authentic conversation about mental health in Australia, where we're at, and what positive steps we need to take to move forward. So let's start with Professor Rapee. Ron, you're a Distinguished Professor of Psychology and the founding director of the Centre for Emotional Health. Now, Ron, you've said anxiety is a normal and critically important emotion that we all experience, and its function is to protect us from danger. And it's anxiety that motivates us to wash our hands, and to wear masks and to be socially distanced, so that we're safe. So I'm interested, how are you seeing the COVID-19 lockdowns impact our mental health, and what role does our personality or our disposition play? Because why are some people that I talk to in Melbourne they'll say to me, I'm sort of okay, and other people are crawling. Can you talk to me about that?
Wow, there's a lot of questions there. I like that first bit where you're saying about the normalness of anxiety, because I think we often forget that. And there's this thing, obviously, when anxiety or any human emotion gets to extreme levels and starts to affect our lives, then it's a problem. We need to do something about it. But we often start to talk in society a great deal about how terrible it is to be anxious, how terrible it is to be depressed. And we forget sometimes that these are fundamental human emotions that actually are important and are important to our survival. And a really good example of that is at the moment, I live in Sydney. And I've been, over the last couple of months, I've started to go back to work and have been catching the train to work. And there's signs everywhere on the trains about wear a mask, wear a mask, wear a mask. And I noticed when I started going on the train 6 weeks ago or so, that there would be maybe about a third, 40% of people on the trains were wearing masks. Now that the Sydney levels of COVID are starting to drop, I've noticed the last couple of weeks that there's almost no one wearing a mask. And I think that's a great illustration of how anxiety is important. We need some level of anxiety, because anxiety then does things like forces to wear masks, and in turn protects society and protects us. So,
can I interrupt you? Is the problem then part of it? Are we throwing the word anxiety around, particularly around our children, and going, you've got anxiety, you're anxious, when maybe they're just normally worried? Is that part of the problem?
To an extent, I have to be very careful here and think very carefully as I speak, because there's a lot of political correctness flying around that I need to watch myself for. But I think that is the case for a lot of problems in general, mental health being one of many sort of issues like this, where raising awareness of these things is really important. And when we have no awareness, limited awareness of mental health, that's a really bad thing. We want people with mental health problems to go and get help. But in turn, it's a very fine balance. And when you start getting overly sensitive to these things, sometimes you do find issues where they don't need to be. And anxiety is particularly one of those situations where it is so normal that sometimes we can get overly concerned about it. And often the best treatment, even where you have serious, or not extreme, but moderate levels of anxiety or even depression, sometimes the best treatment or the best cure is to just get on with your life and get back into things and start to sort of move on with things. And so paying too much of attention to yourself, getting too inwardly focused, can often be worse than just moving on. But I just again repeat, that's not to say we should not be focusing on helping people to recognize anxiety and depression and mental health and doing something about it.
Absolutely. Maggie?
Yeah, I just wanted to throw in my experience over this period of time is that we are biologically wired to be triggered by our children's anxiety, because that's also a sign that maybe they're unsafe. But what we're finding is that with grown-ups in a perpetual state of anxiety, which is absolutely biologically normal in response to a threat to survival, which has no end point. And what I kept hearing was parents just wanted to fix their kids and stop them being anxious. How do I stop them being anxious, instead of working with the notion that they are, minimalizing it and, avoiding it may actually add to their anxiety. It's okay to be like this right now. And this is kind of what we're doing as well. And that collectively we're educating them about normal and healthy anxiety, which often helps us get motivated and focused, exactly as Ron was saying on the train. And then there is a line where it does get to be definitely unhealthy. And I think that's the thing in terms of the parenting I've been doing. And I've ended up working in corporate areas, which of course I never normally do, because I'm, usually too busy in schools and communities. And their whole focus was these professionals working from home with their children at home, not wanting to murder their children, and also deliver 8 hours of work, and wondering why everyone's going, to hell in a handbasket, without a real understanding that there's only so much we can do when we've got heightened levels of stress, and that stress brains don't learn well. We're not very kind, and we often eat more chocolate, let's be honest.
thank you for that, Maggie. That makes me want to go over to Dr. Claire Kelly. Claire, I'm interested because your PhD thesis was on mental health literacy of adolescents, which is fascinating by itself. But can you talk to me about the caution we need as parents of this idea of saying to our kids, or school saying to the kids, about catching up with your schoolwork? You know, we're going to catch up, you're going to get behind, and this big focus on that. Can you talk us through that?
Yes, and look, to be really clear, I don't think that this is just a problem for kids and teenagers either. I think we are torturing ourselves with this same idea. And if anyone in this very illustrious group has ever really felt like they had caught up on their email, on the things that they need to do, on the to-do lists, I would be very, very impressed. But it certainly is not the year to try and do that. Now, I think that we often worry about solutions to sort of individual, like how do we get away from the mindset of catching up? How do we do this? How do we do that? I actually think that whenever we're a bit caught on the best approach, especially because we don't all have time to do all of the research, do all of the reading about the best thing to do, is just to go back to values. And, you know, what are your values? What can you let go? You actually don't have to tick all the boxes. You're allowed to do that. It's just like, you know, you're allowed to eat lasagna in the shower as well. No one's going to stop you. You can drop things off your to-do list and you can say, I want to focus on the most important things. And for me at the moment, the most important things are that us as a family, we're okay, that the kids aren't too stressed, but they also know that they can have some control over the things that are worrying them by wearing masks, by being kinder, by being unnecessarily kind, going out of their way to do something small for a neighbour. I think when it's definitely, it's something that is probably going to be a problem for a couple of years, that there is learning that just didn't happen this year because of the level of stress. And I'm down here in Melbourne, of course, where we are still in extended lockdown. It's not as if any one kid, any one class, any one school is the only one affected by this. It's the entire world. They've got to remember that there's not, it's okay that things moved slower this year. And I think that worrying about trying to catch up is when there's, you know, honestly, I think Ron would agree, there's more productive things to be worried about, things that you can actually make a difference to, instead of trying to cram everything into getting to the bottom of that list and being in step with where you think you might have been if the pandemic hadn't happened this year.
I heard, Claire, I heard a great analogy earlier this year, actually, where somebody said that, you know, people feel like we're juggling all of these balls, but actually yes, quite a few of them are rubber. And, you know, they're not crystal, they're not going to smash. You've got to look, which are the ones that are rubber, they're going to bounce and they'll be okay. So I thought that was a really good way. We're acting as if all of them are made of glass, and they're not. So lasagna in the shower it is.
And I think as well, I mean, I think that it's a concentration of a problem that is an ongoing one. This idea that, you know, we've got to be in step, we've got to be up to date, we can't drop any balls, people are going to judge us, you know, and particularly this year, I think, I mean, we're worried about kids and they're looking at us being worried about everything else. We're not being great role models in that. I mean, I would really just love to see a lot more people just sort of slowing down and saying, you know what, let's just forget this afternoon, let's just hang out, let's binge Netflix, it's okay, it doesn't matter. It's much more important that we're feeling safe, that we're feeling secure, that we're feeling like we're contributing to getting the world back on track and hopefully making it a whole lot better, rather than worrying about, am I going to get the exam marks that I otherwise would have?
Absolutely. Mark, I wanted to go over to you as the head of marketing of QBD bookstores. And I mean, I know for myself, I have absolutely immersed myself in reading this year more than normal, with fiction and escaping, but then also with self-help stuff. So as a retailer, so obviously COVID has thrown all kinds of things to you from a retail point of view, but what sorts of things are you seeing the customers go for? What are they looking for? What have they been buying?
unmute. Initially, it was a huge surge in educational books, products, mind-bogglers, because when the threat of schools closing down and when the schools closed down, I guess the information flowing from the education department in the schools was a bit slow. And then when it did come through, there was challenges actually connecting to the schools themselves. And so we found parents coming to us for product because we saw this huge influx and then a lack of availability. So then we were needing to find alternative education. So if they were looking for a specific product that the school said, but we'd sold out on day one. You know, it shut our online down for 24 hours. It was just this massive surge. Then it was, you know, what else? Well, what are the alternatives? Because parents aren't teachers, and they were looking for guidance as to, you know, what the kids should be reading, what the best, educational books were that, you know, as alternatives to their traditional lists. But also looking for, when things started to settle down and parents started to realise that some of the challenges of getting their kids, particularly their young boys, to read, finding content that would be interesting for their children, something that they would excite them, because they were going to, I guess, a more literary product rather than books that fart and smelly and, you know, but anything that entices a child to engage in reading was something that we were trying to encourage. Also, I guess some of the educational toys, because they may not necessarily be reading the book, but they're reading the instructions as to how to put this game or this product together. So that it's still teaching them, it's getting them to concentrate on something. And as part of reading the instructions, they're learning to engage in with words. So that's what we found. But I guess one of our struggles was the supply chain. So we found people getting very upset about not being able to access this product because, you know, we had, for example, if we had 2,000 books, 2,001 book, but we had 10,000 people trying to purchase it. So it was trying to say, look, it's coming, but right now we're not sure when. We know it's coming. We'll give you updates, but it was very upsetting to those families, and they felt like their children were missing out. And I think that was one of our challenges, was trying to maintain that level of respect in the conversation between our staffs and quite anxious parents. So that was, you know, one of the many challenges that we found through that first 6 weeks. After that, people started to realise that that this is our new normal, that things take longer, and that there are options. So, you know, I think the first 6 weeks of COVID were the hardest. And then, you know, I think things started to settle down, and then we started to see people looking at fiction, more from an escapism point of view, fantasy books, skyrocketed. And then came the mindfulness. So we found it about week 10 is when people started to go, this is not going away. This is going to be here for a long time. And we were looking at not just for adults, but parents with teenage children with high anxiety, particularly those in grade 12, uncertainty about that year, whether they were going to graduate, all of these kind of things, looking for mindfulness things that they could try and engage in conversation with their sons and their daughters, because, you know, this was new to them, and they hadn't seen, you know, kids are at that age can be quite anxious, but the anxiety levels were skyrocketing, and they just didn't know what words and how to engage. So they were coming to us to find things that were, I guess, targeted at that age level.
I'd be fascinated to know if this whole experience of this year has led to a greater love of reading, a greater take up, maybe in some households.
Absolutely. If we just look at our growth across the board in stores and online, Online spiked at close to 500% through COVID. It's now back down to sort of a 20% increase on last year across the board. You know, we can speak to our publishers. You can see that we are frantically trying to restock our shelves because a lot of the new titles were, the launch dates were extended because of COVID. So things that were supposed to be coming out in April, May, June are now coming out in August, but they're going back to some of the old favourites that, you know, our backlist titles. We've never sold more of them. You know, it was get your hands on anything that can get you away from a screen, because that was the other challenge. We needed, you know, people were trying to find alternatives to their phones, to their screens for their children and for themselves.
I've also noticed personally in sort of in my community, in my Facebook community, that not only have people sort of embraced reading a lot more, they've been more willing to try and seek out either online or in person book clubs. So that sense of, you know, finding people who maybe wouldn't usually join a book club are sort of looking for different ways to connect and form, you know, online communities. So I think that's, you know, hopefully a positive that has come out of this experience. But looking at what we're actively consuming in terms of entertainment and news as a means of managing our anxiety, Ron has said to avoid highly emotional news sources and look for official sources of information, which will be more measured. So if I go to Kylie, Dr. Kylie King, you're a senior research fellow at the Turner Institute for Brain and Mental Health at Monash. This is even more important when it comes to statistical reporting, isn't it? What are the true figures regarding the suicide rate that we should be referring to?
Well, yeah, that's a really good point. So last year in Australia, we had just over 3,000 deaths from suicide, of which about 3/4 were by men. And so if we equate that to a rate per 100,000, which everyone seems exceptionally comfortable with now, thanks to COVID, it's about 12 per 100,000 is the rate of suicide each year, but it is higher for men. So it's at about 18.6 for men compared to 5.7 for women. And so unfortunately, we know suicide is the leading cause of death for all people in Australia aged 15 to 44. But I think it's important to note also that there has been some early analysis of suicide data this year because there were concerns that COVID would lead to an increase in suicide deaths, and we're not seeing any increases yet, which is great news. So not to say that it's not something we shouldn't be concerned about, and, you know, we might see other impacts as time goes on and some more of the economic and other impacts of the virus are felt. And it might be that there are particular groups within society and particularly vulnerable members that might be experiencing a more significant impact on suicide than others. But yeah, it is good to know and reassuring that we're not seeing that increase at the moment. And so I think it's important to be mindful around the language that we use around suicide too, and not be, you see a lot of stuff in the media talking about, you know, predicted, you know, tsunami and surge in suicide rates, and that's not what we're seeing yet, which is great news.
Maggie, can I bring you in here? Obviously, you know, you are, I think, Australia's best loved parenting educator, podcast host, best-selling author. Now your new book is really focused on teenage boys. And I've got here because you felt so strongly about the higher rate of suicide among teen boys and girls. What surprised you the most, and what does it make you feel that we need to focus on? What are we getting wrong? That's what I want to know.
Kylie, I wish I'd found you while I was doing all my research on the book. Okay, so with the, you know, it's over 42 years since I stepped into the classroom and noticed there was a distinct difference the way that our boys negotiated with the learning environment, and that some of those behaviours that they were getting busted for and shamed for and punished for, I kept noticing kind of happened each year, it rolled in. And I thought, so it's a bit like trying to punish a 4-year-old boy who just wants to run really fast everywhere because he's got this huge surge of testosterone. So we were punishing them for kind of things that they do a little more than girls. So I thought, you know, underneath all that, I decided not to add any more shame or punishment to it. And then eventually I stepped out of the classroom. And in to do counselling, and it was this, what boys would tell me was not what I thought they'd tell me. They really wanted to talk to somebody. They just didn't find anybody who, you know, like knew how to communicate with them, but also made them not feel judged. And then they've also coming through with the old man box with a lot of shaming for things. So boys shaming that happens as little boys for all those reasons. Can't sit still on the mat. He must have ADHD. Why is he always playing with his penis? Why can't he, you know, why can't he stop punching kids and shoving them over? When we understand that, by the time you get to be a boy, all of that kind of angst is inside. And when the limbic brain grows, it gets more explosive. But also that explosions that often happen when combined with brain changes means they feel even more stupid, more dumb, and inevitably bad. So you collide all those together, give them a couple of challenges where they lose publicly. And of course, suicide's an option to leave the world because it's just not very nice. And no one really cares. No one understands me. And they're more prone to use a more violent means as well. So I guess I just wanted to be a voice that says, if we could understand that, you know, instead of conditioning boys that are supposed to be tough and stoic and deal with their problems by themselves, you know, I started with mothering our boys. We've got to actually help them learn that big feelings are normal, that it's okay to have them, but how we express them without hurting others is important. And I think underneath it was a really popular thing that has happened with it, and I'm getting so much feedback, is my tips around really communicating with a teen boy. The shifts that have been happening in homes, like within days, where boys are now having big conversations with their parents, usually when they drive the car, instead of looking them eyeball to eyeball. Parents are going, they're coming to us when they're worried now. That never happened before. So again, my passion was to build a real understanding under that grumpy monosyllabic mask, which everybody seems to think every boy is doing as well. But also, you know, let's help them to navigate that bridge to manhood without the man box kind of defining who they need to be. So like I said, a bit of a life's work, and I really start the book by dedicating it to all the boys who struggle when they get to school, who've already thought they're dumb and stupid, who can't sit still, or they've got a neurodivergent brain. Because I think we focus on the academic end to pointy end to let you achieve brilliantly. Well, what about all those that's not their thing? And then you put them in classrooms where they often spontaneously behave, make poor choices, and then find there's no teacher who kind of really makes them feel they care. Well, they are on a pathway for a very difficult transition into the real world and into relationships and life later. So I just wanted to shine a light into that dark place and hope we build understanding.
Maggie, can you just tell me, what are you seeing in schools? What impact is COVID having? Do you see? What do you think?
I just think it's made things a little worse. But what it's also sort of done, you know, when we had to say to them, one of the most important things that is a biological driver in adolescence is connecting with friends and mates. So when you take that away, and remember that boys don't, their friendships are not always based on verbal communication. It's more physicality. You know, I'm going to slap him and shove him. I'm going to have a bit of a fake wrestle, or we'll go and kick a footy, or we'll go and kick a round ball, whichever football code you're into. Well, you take all that away, you've got this massive void of connection. So we encourage them to be online. But of course, you know, the stuff in the book that I discovered about our boys who have been marinated in a violent culture online, whether it's gaming or it's violent movies, and then revolting pornography, is that we're creating for a lot of boys a bit of a compassion void where they don't feel as much. So they're actually a bit nastier. And so we're finding, you know, girls are really PhD at being nasty, but I'm finding now that I'm getting more and more messages of boys being, you know, like, don't give a shit about anybody. I'm just going to go and game for 5 hours, 10 hours. I don't really care. I don't need to see my friends. So we're actually creating more social anxiety with boys, and an inability to, of course, mum and dad are stressed if they've got both parents. Then school and Zoom, well, trust me, you know, that how does a boy walk around and, you know, be a bit cheeky to lighten his, you know, lift his dopamine level. So I'm finding it's just making what was there trickier and worse. I don't know if Kylie would agree with me. It's just making it worse. And often poor old mum is the one copying it at the moment. We always know that mum's usually the safe dumping ground, but at the moment they're exhausted too. And I've had so many desperate messages from mums just really actually starting to completely dislike this grumpy, horrible boy that's projecting all his stuff onto his mum.
So what would be your best tip, or a great tip that you would have for parents of particularly teenage boys right now? What would you say who are struggling, if the parents are struggling?
To absolutely have the assumption that they are at high risk of making really poor choices. Just assume they're at high risk, that there's a chance they're going to make a choice that's going to really impact their life in a very negative way, and treat them, I know this sounds a little bit rude, but treat them like they've have an acquired brain injury, and that what in actual fact they need is exactly what they needed as a 4-year-old. And they need a parent who's absolutely keeps saying, no matter what happens, I've got your back. Ferociously tell them, that I love you, even if they roll their eyes. And keep on reminding them again that you're always there. You're always there, even if that's the last thing you want to say because they've just slammed the door and told you to get effed. I think it's that fierce, unconditional love while they can't love themselves. And it's very similar to girls, but girls will share that often with their friendship groups and share that with a significant female. I think it's that inside you is something that's quite tender and it's hurting and it's crushed. So that's just my sense at the moment.
And I've always loved, Maggie, the advice that you give about the
well-timed fart. Yeah, absolutely.
I wasn't going to say that. I was going to say the love bridges.
Oh, sorry. Yeah, love bridges. Yeah, micro moments.
Touching.
But I can tell you now it's how do I connect without verbally?
The touching on the shoulder, you've said.
The ruffle of the head, the punch on the arm, the lean on them. I did a lot of sitting on my boys unexpectedly while they were on the couch. Just sit on them. What are you doing, Mum? What are you doing? But what happened as a consequence, there was a physical connection. Yeah, I tread on their foot a lot. I have actually a couple of them say I still do that. So I've obviously need to improve my connection. And I think it's those little things. You're exactly right. What are the little moments? Whatever their favourite snack is, whatever their favourite, hot drink is. Just every now and then after they've given you double barrels, go and give them a hot drink and a nice, Tim Tam or a home-baked cookie if you're into that. Because that builds a bridge immediately that we are okay without having a big, deep, meaningful conversation. I'm reassured she's okay, we're okay, and that's what they need, little doses of that, a lot more.
It's showing the love behind the scenes, isn't it? It's that.
Yeah,
that's amazing. I love that. If I go back to Claire, so Claire, you're the co-founder of our very own homegrown world's best practice first aid training program, Teen Mental Health First Aid, and you see every day the difference that it makes. Can you tell us a little bit about it?
Sure. So this is a program that took quite a few years to really get right, because we wanted, rather than looking at what had been done before and some of the research that was out there that was really sort of very focused on teaching kids about mental health, we knew that we wanted a really skills-based program. So we actually started off by developing guidelines on what such a program should include. And and one of the things that we were very certain of right from the beginning was that we were going to need to be able to directly address how to support a friend who is suicidal. And that's one of the things that has made this program very different to so much of what's out there. It does actually assume a bit of mental health literacy to start with. And as much as, yes, I did many years ago do my PhD on adolescent mental health literacy, it's all irrelevant now because it's so good to see how much more they get from younger and younger ages. So that mental health literacy creeps up in a way that they might not even notice themselves initially. But what we were consistently hearing is there's this feeling of, I can see if a friend is depressed, I can see that my friend is in a really bad state, but I don't know what to do. I'm afraid I'm going to make things worse. I'm afraid that I'm going to be asked to keep a secret that I don't want to keep, but I have to because they're my friend. And they didn't have the skills, they didn't have the confidence, and big surprise, I know, a sense that adults won't understand. So we started off with really what should be included in this material, and it was young people who themselves were no more than sort of 3 or 4 years out of high school who'd experienced mental health problems during high school, and youth mental health experts, and a number of our mental health first aid instructors as well, who have got decades of experience in schools. And we developed a program that it's actually, there's 2 programs, one for kids in grades 7 to 9, which has been a bit of a slower starter, and the one for kids in grades 10 to 12, which is the one that it's really taken off in a big way in Australia and overseas. And really the initial research for that was actually supported by Australian Rotary Health, so that's always wonderful. But it's really about understanding what you might see if a friend's experiencing a mental health problem, how to recognise if somebody may be in crisis, how to have a conversation, which is scary for anyone at any age, but that doesn't mean that it's difficult. It's emotionally hard, but you can learn those skills quite easily and have some confidence that you can really make a difference. So we've got kids out there actually being able to ask the question, when they've got a friend who's really distressed or talking about just feeling like there's no way out, or how much better off their family would be without them, or that there's just no hope for the future, that they can say, hey, you sound really upset right now. Have you been having thoughts of suicide? And that conversation can actually happen in a way that leads kids to getting supported by the adults around them, and ideally receiving some professional help.
Claire, would you say that, because this is definitely something that I'm seeing reflected when I go into school, so even in primary school. So what I'm seeing is like grade 5 and 6 girls in particular. And I think this is something that has not been helped by smartphones, in a way that late night conversations, so late night, all of a sudden one friend will be messaging another friend and offload a massive issue that they're dealing with, and then say to somebody, to a 10-year-old, you can't tell anyone. You can't tell anyone that this is happening to me, or I'm feeling this way, or whatever it is. So do you think, has it become worse? I don't want to blame smartphones or everything, but has social media in a way, or smartphones, that technology of these late night kind of conversations, I feel like a lot of teenagers are walking around with all of these concerns on their shoulders that aren't necessarily their own, of how to handle their friends or even their parents' mental health issues.
Mm-hmm. Look, I think that it's changed it. I'm never really comfortable saying if something's better or worse. I think that the challenges change and the opportunities change as well. And I certainly, I've had conversations with parents where they're saying, oh, my kids are on the phone. I didn't realize it was 3 o'clock in the morning. They're having this heavy conversation. And I think, 15 years ago, they would have been awake at 3 o'clock in the morning on their own and not having that conversation. So instead of saying, this is social media, we've got to get them off that, or we've got to reduce their access to social media, let's instead improve the skills. Let's actually say, look, if someone's upset and you're talking on Snapchat or Facebook or wherever, I mean, there's so many of them these days. It's really just about whatever makes them feel comfortable, wherever they've sort of found their place to belong online. Instead of focusing on all of those individual platforms and all of the individual downfalls, they move way faster than any kind of policy or any kind of education. So again, get back to values. If somebody's telling you that they are that hurt, it means that they want something to change. And the fact that they've told you about it, even if they say, this has got to be a secret, it's got to be between us, they want something to change. And that's what you've got to focus on. I care about you too much to keep this a secret.
Yeah, that's good advice. Actually, you're saying if they're telling you they want something to change.
Yes, absolutely. And look, I've had some just absolutely heartbreaking stories, particularly with young women, where they've said something like, yeah, I did that. I told a teacher that my friend was planning to die by suicide, and she hates me. She's never going to talk to me again. And you find out that this happened 2 months ago, and you say, wow, you saved your friend's life. That's such an extraordinary thing. And I hope that when your friend starts to get better, she's going to recognize what you did, because you don't tell someone if you don't want things to change. You know, it's there. So the fact that the person's still there. Maggie, yeah.
I just want to ask a question of both of Claire, Kylie and Ron. What has sort of come up in the research for the book, and it definitely came up with some of the boys' surveys, was these boys that are dying by suicide with absolutely no mental illness and no change in behaviour and no red flags at all. And I just want to know, have you got any research on that or understanding of it? The psychiatrist I spoke to he specialises in youth, and he said, where he's in the bottom of WA. He said it is just absolutely mystifying, and he and his expert in Sydney said they started to see this. And I just want to know, is there anything else out there? Has anyone explored these ones that do have no red flags at all?
Well, I think it means that we're looking for the wrong red flags. We might think we know what they all are, but boys who are sensation seeking, who are impulsive, who respond very quickly with any kind of emotion that perhaps fizzles out very quickly. 1 minute they're the holy terror, frightening you because they're so angry, and then 20 minutes later you've got your nice boy again.
Well,
you're talking about very rapid changes. A
lot of these, and I'm saying this is just because of there were 8 or 9 they'd identified, were top students. So they weren't they're displaying that. They also were top academically, sporting wise. Some of them were in even accelerated classes. So
so I think this is the other end, Ron. I would think that pressure and perfectionism are probably playing a really big part here. Yeah. Would you agree?
Yeah. And terror of failing. Like, you've put me so high up, the fall from here is pretty big, so I might just bail, a bit like I don't participate, so I can't fail. Ron, what are your thoughts?
Yeah, look, that could certainly be the case. And I know someone had mentioned the Northern Beaches clusters, and I know there was 1 or 2 there where people were talking about the idea that that was that pressure and that sense of trying to live up, that put a huge pressure on a young man who then killed himself. I think, to me, look, it's very possible that, I never say things are impossible, but I would find it very hard to believe that people kill themselves with no trigger or with no red flag. I think, as Claire said, if we're finding cases where there were no obvious red flags, it's because we haven't looked at those flags, or it's just that young man, which is much more common, that young man has just not come up to awareness, that he hadn't been assessed, that he hasn't said things that people have picked up on. But the flags were probably there, or the factors underlying it, the anxiety, the depression, the substance use, the impulsivity, almost certainly would have been there. But it's very, very possible that people would have missed them.
And perhaps that friends might have been the ones to see them rather than family members as well. Sorry, Kylie.
Oh, no, that's all right. I was going to say, I think there is a huge pressure on young boys and men to keep things to themselves and not to show if they're struggling. And obviously some young boys and men are exceptionally good at that. And so I think perhaps that might be something about what's going on as well. And I think that obviously speaks to a broader issue with the culture around boys and men that we need to address.
MDMA, apparently one of the ones that we had suicide down here, had all the tickets. Made lunch plans the next day, had a girlfriend, had a really good career. He had all these things. He was incredibly stable, but had started to use MDMA. And apparently there can be this massive drop after the serotonin is flooded out. Apparently this was just, he was actually watching TV in the same room as his brother, who he gets on really well with, and just went off the bathroom and obviously taken, and so it's like gobsmacked moment. Is there anyone looking into that link? I mean, we know that you can obviously overdose. This was not an overdose. It was that crushing, dark place that sometimes the after effects of these drugs can get you to. And MDMA usage of teens is actually on the rise, and alcohol usage is on the...
Yeah. I'm not aware of any specific research into that, but I think it's important to remember too that the pathway to suicide is very often quite complex and very individual, and it's often a multitude of factors that can come together, perhaps triggered by, a particular crisis. So yeah, we certainly need to do a lot more research to understand the pathways to suicide for young boys and young women too.
Can I bring in Ben now? And Ben, you have been in close touch lately with the devastated families from Sydney's Northern Beaches who are conducting local meetings and I think pushing for mental health first aid in the schools. And what are you seeing on the ground? How are the parents and the communities feeling there?
Look, I think the number one thing is that a lot of parents are, as everyone's mentioned before, struggling to try and talk to their kids. And when I've sort of come back into the office and spoken to other parents, they've said exactly that. Like, I'm really concerned that I've been blowing off and just thinking that small anxieties are nothing when in fact they could be something significant. I interviewed Claudia Neal's family, and Claudia Neal was 18. She died by suicide. She was at a private girls' school on the North Shore. And she was that A-type personality, very confident, very good looking, very popular with her friends, but also had a significant mental health issue. And there were a cluster of things that were in the background that I wasn't able to print. But fundamentally, the parents talked about the fact of this isolation that a lot of kids can experience. I suppose when they're on their phones and they're texting, but they're not necessarily having the same eye-to-eye contact where you can get so much more. And so texting sort of becomes a substitute for real conversation. And you forget how much human touch, eyeballing someone can just unlock so much of your humanity. And you see when words pop up on the screen on your phone, it's only a real fraction of the interaction that you should be having. So I think that was a really big thing that has been happening. Obviously, the stuff about not being able to have a formal, not having that release, the massive concerns about what's going to happen after school, they're a huge problem. Because I suppose in a broader sense, we're obviously dealing with this pandemic and we've kind of had no option but to shut down. But the expense that we're seeing is with our young people, because the reality is they're not going to have the opportunities that a lot of other people have had. They're not going to have the jobs, they're not going to have the casual income. I spoke to a young girl, Paris Jeffcoat, who runs a mental health charity on the Northern Beaches last week, and she was saying that one of the big lifesavers is job seeker, because everyone's incomes are being crashed, their casual incomes, by the loss of hospitality gigs. And yeah, they're really worried about the future. So I think that's a big thing. And I suppose as a society, we've kind of made the sacrifice of the economy to save our most vulnerable, but there is a sort of reaction to that, and our young people are the ones that are copying it the most. So I think that's probably been one of the biggest things I've noticed.
Could we talk about, Ben, reporting, I guess, of how mental health issues are reported in the media, and how can we be doing that better? I guess I want to say is, we talk about the value of lived experience, to look at that in a positive way, in a preventative way. Do you see for yourself, do you think that news platforms are handling it better in how they're reporting mental health stories?
Yeah, look, I think there's a lot of inexperience in the media. And so you might get a young journo that comes across a story legitimately and doesn't quite know how to handle it. I mean, I suppose I'm 36. I've covered mental health for probably 5 years. I lost my old man to suicide myself. That was more than a decade ago, and I've sort of written about that. So I kind of understand the sensitivities around it, and I've made mistakes like everybody. But yeah, I mean, there is a real belief within the mental health sector that you can't really talk about kids that have suicided. It's almost always frowned upon, and I've almost always said, now's not the time you've got to do it later. But that actually, what they really mean is you shouldn't really do it at all. And look, I think it's kind of a false economy, because if this conversation, it's not like 20 years ago, 30 years ago, when these sorts of difficult conversations could be quarantined within communities. They can't now. Like, social media organizations do get around to removing that content, but it still remains. It's still tagged. Like, I can still go to Insta now and find that info, and kids are looking at that. And so kids are discussing suicide on social media now. Like, the cat is out of the bag, and yet I encounter resistance from time to time, saying you shouldn't be writing about this, you shouldn't be doing this. Like, obviously I write about it and ensure that we don't talk about the method by which people die. We don't say committed suicide, we obviously say suicided or something thereabouts. And I suppose the story that we did with Claudia Neal, parents, I focused on the positive and I focused on the fact that young people need to understand that they are enough, that their relationships are enough, that they themselves are enough. They don't need to be any more than what they are, because they're great as they are. But yeah, I suppose, I feel that pressure significantly, and so yes, there is a place for lived experience stories, and I put one in the Sunday Telegraph last week about a girl from Batir who had a really good lived experience story. But the reality is that they do not get the interest, that they do not have the same impact, obviously, and they don't get governments to move. We've made governments move with our campaign in 2015 with Headspace. We managed to save the youth early psychosis program that was going to be cut. And the reason why is because we pushed them on it. And it's a hard thing, but I think I find that some in the mental health space are very rigid and don't want to discuss suicide at all. Or if they do, they want to minimize it to the back and only do very small snippets of it. But I sort of feel like we've moved beyond that thinking, and yeah.
Could I respond to that as well? I think that there's actually we found out a long time ago, probably 25, 30 years ago, that reporting, this is very, very specifically, the reporting on specific means of suicide seemed to increase the use of that means. And that's it. And that has been extrapolated out to, you can't talk about it or it'll make it worse. You can't talk about it in schools. It's not our role. Kids can't talk about it. They don't have the ability to cope with it. And it's just, keeping quiet about it is not working. So I agree. And thanks, Ben. I think that we've got to do it in a way that's responsible. We've got to do it because that's silence. And it's also, I think, probably when we first started talking about a lot of media guidelines and how it was okay how we should talk about suicide or not, was before there was, before the internet was like anything like what it looks like now, and particularly so much direct messaging between people where those conversations are happening and nobody is saying, oh, you need to do this safely. So upskilling people is crucial.
Because everyone's, I guess from a parent point of view, parents are terrified in schools, I guess, of planting the seed. So that's where it all, if we mention it, we're giving them the idea, which is not the case, but that's where it's coming from, isn't it? This idea of, if we bring it up in conversation, it's going to put the idea.
Yeah, 100%. And
Marg, I saw that you wanted to say something.
Yeah, well, as a mother of boys and boys both that have gone through their challenges, and bringing up, I guess, our fears of where their mental health was a challenge, because we didn't want to push them away, but we had to try and find ways to open up conversation. And sometimes it was actually approaching other members of our family or friends to say, look, we have these concerns. You know, are you able to have a chat? Are you able to kind of pop in? And then, you know, I found with my oldest son, my cousin and my uncle were able to break down some of those barriers because we couldn't. But it was just a safer place for them to have a conversation. And they weren't entirely open with them, but you know, they were able to get some insights that we couldn't as parents because they were so guarded. You know, when they were facing challenges, you know, and when Will, my stepson, had a really challenging time, we found that he actually went to church and he got closer to his youth group community, and we were able to reach out to them and sort of say, these are our concerns, and they kind of gave them more of a collective hug at the time. So I think we need to think outside of the box. If we can't have that conversation, we need to sort of say, okay, we are part of that community, and let's reach out to people that might be able to, you know, help us out and give them that collective hug, or let them know it's okay, that they're cared for, that people value them outside of the people that they kind of sometimes disregard as their parents because that we don't know any better, or, you know, we're too judgmental, or we're trying to put them in a box, whereas other people can have that conversation without necessarily having being as direct as sometimes we intentionally are. That makes sense.
If we look at, I guess, you know, following on from that, Mark, the importance of parents or the adults in our kids' lives being role models, the role modelling or setting the tone of looking after our own mental health, to normalise that, I guess, in households. So if we look at new research that was recently released by 10 to Men, which is the longitudinal study into male health, said that most men who reported mental health concerns in the past year had seen a GP, but less than half had seen a mental health professional. And so I guess, Kylie, I just wanted to know your thoughts on that if adult men, you know, the dads or the uncles or the grandfathers or whatever, you know, they're not necessarily seeking out the mental health support.
Yeah, so you were wondering about why that was, or what was going on there. I think we've already spoken quite a lot about some of the pressures on men to keep, you know, quiet around emotional problems, and there's a lot of shame around seeking help. And I think women experience this too, of course, but I think men experience it to a greater degree. And so I think because of that, because a lot of men don't talk openly about the struggles or their feelings, then there can be not a great awareness of the prevalence of emotional problems and personal problems and mental health problems amongst other men. So often younger boys and men might sort of incorrectly believe that other boys and men aren't experiencing any problems, when in fact they quite likely are, because they're human and everybody does. And also there's a bit of research coming out lately too that suggests that when men do seek help, perhaps they don't get the sort of help that they need, that perhaps our services aren't as tailored to the needs of boys and men as they could be. So we're starting to think about that a lot more too, so that men and boys are getting more positive experiences when they reach out to services for help.
Brenda, did you have some feedback on that as well? What are your thoughts?
This is a really kind of hard, emotive conversation for me to sit here and listen to, and I thank everybody for the time. I've got two teenage boys as well, so it's hitting quite close to home for me. I think Kylie just alluded to it. We hear from our audience a lot that it is actually access to services when somebody is having an acute episode that are failing us dismally. I think there is great awareness, and as Ron alluded to earlier, perhaps even maybe an over an awareness to mental health issues and anxiety. And if somebody actually has to seek help, where do they go? How do they find that help? We live in a rural residential area or regional area, and services for mental health, once somebody asks for help, are nigh on non-existent. We've got acute mental health patients just in an ASU ward at the General Hospital being cared for by nurses who are already stretched to capacity and ill-equipped to deal with it. So my view is that it's fantastic that we raise awareness, but if there's no services there to support people when they actually acknowledge that they need help, I think we're wasting our time.
Can I just jump in there one thing, and that's that rural remote, Brendan, you're absolutely right. Boys will tend to, if you can ever get them to see someone, they give it one go. Mm-hmm. So if that person's unable to, build rapport and connect with a boy through boy language, that's it, done. It's never going to happen. My other real concern, and I know I'm going to get kicked in the butt at some point when someone from Headspace reads that part of the book, the most common bit I get from parents is that, they did get their son to go to Headspace, and that was, like it was a toe in the door, and he was agreed to go the second time. But the second time you get a completely different counsellor. There's no continuity. Well, that was it, because to build trust, man, that takes some time for both girls and boys, but that was it. That was a sign that they don't really care because the other person doesn't want to see me. So we then end up with one that could be escalating in terms of their risks and now completely blocking. So you're absolutely right, but that's kind of what I wanted to have, that, around the edges, the more informed we are, is I call it the tribe around our boys. So like I was more caring of all my boys' mates in terms of my pastoral care and, than I was my own, because they just thought I was full of, what. And I think I called, very much in the book is the call to collective again, that we have to be looking after all our boys, regardless of whether they live next door to you or they're a different coloured family or something, is that we have to kind of, because they really do respond. If someone shows me I matter, they do respond to that. And yes, they don't always want to come to mum and dad because they don't want to disappoint us. That's the most common thing they tell us. I don't want to disappoint them. I don't want to let them down again. So again, it's letting them know from when they're little boys and our little girls that it's, there are a whole circle of people who really do, who are safe enough. Who are your safe people? Because they tend to, boys particularly like safe people that knew them when they were little boys before they became a feral boy. They absolutely do. And they often, their body language changes when they're around those people. It might be a former teacher or a coach or an auntie or an uncle. My gosh, the difference in them as they've found a safe person, because it takes a while to get the safe tick in a boy's world. So you're absolutely right with all of those great suggestions.
Sorry, can I just, sorry to interrupt. Can I just follow from what Brendan was saying, because I think that's a really important issue about finding appropriate care. As Claire said earlier, one of the great things now in our society is that our levels of mental health literacy are much higher than they have been ever. People are really good at identifying mental health issues now, and people are getting much, much better at talking about it and at admitting to issues. So our next frontier is trying to work out the mental health system in such a way that people can actually find their way around it, because navigating the mental health system is completely impossible. As a mental health professional, I struggle tremendously. If I have friends or family ask me, where can I go for help? I don't really know. And so if I don't know, then how is the general public going to know? And so that's the next thing we have to do. There's no good answer that I'm aware of, but that's the next step, is that governments or whoever it is needs to find a way of making the mental health system far more navigable, and not just any parts of the mental health system, but also making sure that what's offered in the mental health system is scientifically tested, because that's the other thing. There's a lot of stuff out there which is very questionable. And so having not only good navigation into the system, but then making sure that what people get is properly tested and actually works are really the next steps that our society has to go to.
I just wanted to, I guess, wrap up on a positive with Claire to talk about just the major success that you had, particularly last year with Lady Gaga, the teen mental health first aid. So can you just, because that's such a success story, I think, with her wanting to take it into the States, or she has taken it in. Can you just talk to us a little bit?
Yeah. Well, once upon a time, there was a fabulous pop star. Now, Lady Gaga has been a supporter of mental health initiatives for a long time, and particularly for kids who, for whatever reason, feel they don't quite fit in. The Born This Way Foundation is really all about that. And when we've had mental health first aid running in the United States since, 2009. So it has been around for a while. And when Mental Health First Aid USA heard that Lady Gaga was looking for something to support for schools, she wasn't interested in anyone developing a brand new wheel. It was all about what already exists in the world that we could adapt here and bring over, and has got some evidence behind it. And so Mental Health First Aid USA reached out to her. She loved that we were directly addressing the topics that people have been so reluctant to address, like suicide directly. And so initially there was certainly an investment of significant funds to get the program adapted over there and piloted in, I think it was 16 schools initially. Although their overall plan is that it will be in every single school. I think, I'd love to see that. If they can do it, then maybe we can prove that we can do it as well. But it's not just that. It was actually, she really threw her name behind it. She's whether people like her music or not, there's an enormous amount of respect for someone who is so unapologetically themselves. And that's definitely something that's come behind. So she actually, the really exciting thing was, after the pilot finished up, she met with 2 kids from each of the schools in an airport in Las Vegas. I imagine that was quite a moment for the people who were walking around. Is that? No, it can't be. But all the kids who had been flown out from those schools all over the States were actually invited to her concert and invited to come up onto the stage and talk about a little bit about what they'd learned in Teen Mental Health First Aid, in their Teen Mental Health First Aid course. And also, and she then spoke herself about her experiences of PTSD and how important it is to start these sorts of conversations. So from there, it's really just, it continues to spread. And I think it's really important. It's not just about talking about mental health. It's talking about, how do I support this person that's in front of me and needs something. And I think that, as much as I completely agree with Ron about the mental health system, I'd also like to see that perhaps people who have milder problems don't feel that, oh my God, this is a terrible thing that's happening to me. That if we were more comfortable talking to each other about the way that we feel, and oh yeah, I feel like that sometimes too, that perhaps we wouldn't necessarily escalate in the same way. There's nothing like being anxious about being anxious to make you more anxious. So I think that it's a combination of things. It's about, it's having those skills. It's being able to actually feel as if, this isn't some dorky thing that you do at school. It's oh my gosh, this is a life skill that I've got that I can take out to my friends and can make a real difference. And I'm very, very glad that it got out when it did, because it has certainly, it's now something that is proven over there, that hopefully with the additional support that we know kids are going to require as we go back to whatever the next normal is, that it'll continue to spread over there and also here.
That's so terrific. It
was very, very exciting. Very exciting. So basically, Lady Gaga and I are basically best friends. We haven't met yet. She doesn't know that, but we are.
That's a small detail.
Claire, have you been aware of the STYMI program? Because I think those two step so beautifully together if you've got teen mental health through the school, and then the option for anonymous reporting within a school system. Because remember, we've got those kids who won't break that trust.
Yeah.
Was like, but whereas when it's anonymous and when it's presented with that amazing, Rachel Downs, the way she set it up, because of course she's been a little bit like some of us who've worked in schools, that after there's a suicide, there'll be kids who said, I knew about that, but they told me to keep quiet. I think the two sit beautifully together, and Rachel's such a wonderful social entrepreneur, because that's part of what we're doing down here. We've activated a Makuta masks where the community's made masks, we've sold masks. That money is now going to those sorts of programs. I'm going to double check every school in our area has done yours. But then what it is, is that's now paying for that to come in to sit over the top of it. So it not only does it give kids agency, but it also shows parents and educators that we are doing something, because that was really the perception. What are you doing? You know, what are you doing to stop this? Whereas, so again, we've had people helping to, you know, make the mask, fundraise, to create the funds, that create the programs that we know work. So this has been a perfect liaise for me, because I'm the consultant that helps point the things in the direction of where money goes to. But also, one of the things that happened was one of the high schools in the area, which is kind of probably 25 k's from the two that have been impacted, they jumped on board to use their home ec class to make masks. And while they're doing that, they basically were having really big conversations. Again, so that actually is exactly what you want. You want those conversations, which are nuanced and well-informed, right there with the teenagers, and then give them an opportunity to help. And I think they're the little bits that incrementally we're looking at in this area. It's not just, you know, activating where are all the helpers. It's about that gradual awareness lifting, education lifting, and then what sorts of action steps can we have. So that's why we painted the whole of Gerringong yellow, because we wanted to basically shift it from being in despair. Our town we've got yellow pom-poms everywhere, ribbons everywhere, and it really shifted everyone from being in such a dark space. And that's when we got the elderly making it, and we got the kids in childcare making it, and the primary school school went yellow, and then they made signs to put outside the local high school where the suicide, you know, person was, wishing the year 12s, big yellow signs, wishing them luck in their exams. So what we did was a ripple effect of positivity that kind of drew us back out of just, you know, that endless despair when we were just thinking we're going down a never-ending hole. So, but what happens now is people stop in Gerringong and go, what are all the yellow ribbons for? So it's a bit like the Blue Tree Project. that we're now, everyone in our community is very happy to have conversations with people about mental health awareness. So that's a story.
It's great. I think we've got to have, I like the way you said the little things, because I think we have to have conversations about important things when they don't matter, so that when it really counts, it's already easier to talk about it.
Good one.
Thank you so much. I think, Cara, we're probably gone way over time today.